So a lot of us, based on the activities we do or the sports we play, get pain or soreness in our chest, in our ribs. It can be obviously very discomforting. It can be painful. What can we do? So to discuss that, today we have Dr. Ward with Ward Chiropractic and Rehabilitation. Hello, Dr. Ward.
Hello.
All right. So if individuals are experiencing pain in their chest and their ribs, what are the causes and what are things they could do to help?
Great question, Rob. So the first thing I like to rule out in these scenarios is like a possible cardiac issue because that's something that needs to be addressed immediately and that's a medical emergency. So if you're short of breath or you feel like the chest pain's getting a lot worse, anytime you have chest pain, you should get evaluated by your primary or urgent care or a hospital immediately to make sure it's not a cardiac issue. But if you've done that and they've ruled that out, the number one cause of chest pain, a lot of people don't know this, but it's actually musculoskeletal. So we see a lot of pain at the joints where the ribs meet the sternum. And the technical term for that would be costochondritis. And then we also see some pain around the ribs. And these are usually overuse issues. We see them a lot in professional people who are in like a hunched forward position all the time, like we all are on computers and phones. And it can be a extremely frustrating issue for people to have because we can't immobilize the chest. We can't rest the chest because every time we're breathing, those ribs are moving. So it tends to be very frustrating to treat. But if you're having this issue and you've had the cardiac and other issues ruled out, some things you could try to loosen that area actually would focus on the upper back because the problem is the upper back gets super tight and then the area in the front has to make up the motion. So some good things to try if you have this problem would be using a foam roller on that upper back. You'd put it perpendicular to your spine and then you roll on it in extension to kind of open up that whole area. You could try it for a few minutes, a couple times a day. And then another thing you could explore would be breathing with the diaphragm. So rather than breathing with the chest, trying to breathe more with that belly. And that will allow that chest to heal because it's not moving as much if we're actually taking a breath in through the belly. Now, if you've tried some of these things and you're still having the persistent or intermittent chest pain, burning, rib pain, chiropractic can certainly help with that issue.
Great. Very insightful. Definitely learned a lot today. And obviously chest and rib pain can disrupt not just your day, but your entire life. So very helpful. Appreciate your insight, Dr. Ward. We'll talk soon.
Sounds good.
Thanks.